Dr. David Satcher is the 16th Surgeon General of the United States. He is the founding director and senior advisor of the Satcher Health Leadership Institute of Morehouse School of Medicine in Atlanta, Georgia. Ladies and gentlemen, please welcome Dr. David Satcher.
Well, thank you very much for that very kind introduction and all of your warm receptions. I'm just delighted to be here. I wish I had time to tell you what the church has meant in my life. I think I'll just tell you a story. I grew up on a 44-acre farm outside of Anniston, Alabama. Neither of my parents finished elementary school, but they were biblical scholars. Yeah, they were. My dad was superintendent of the Sunday school for 25 years. Mount Liberty Baptist Church, 25 years. And my mom was very active in church. But I have one story to tell you about my mom. When we were growing up, of course, we had these big revivals. And you remember, you may even do it now. They would open the door of the church, and kids especially would get up and join the church. Generally, they had it planned. They knew who was going to go first, and then everybody would follow. We had sort of decided that I was going to go first among the kids who were on the mourners bench with me. My mother got wind of it, and so she made it very clear to me that I was not ready to join church. She said I had to stop lying and fighting. She had a list of things that I had to do before I could join church. Well, you know, I tried to fool her, but that was not easy. So a few years went by, and I alone sat on that mourners bench every year. The kids would get up and they would join, and people would really pray hard for me. So this one year, I went to my mom and really pleaded, and she said, well, David, I think you are ready to join the church. So I'm going to have you join the church, but I want you to remember what this means and the significance of this. So sure enough, at the age of 9, I got off the mourners bench as a result of a lot of prayers. And now, I'm not sure that my mother actually believed that I had quit doing all of those things that were on her list, but I think she knew that I was trying. I could tell you a lot about my parents, but I'll just say a word. When I graduated from Morehouse College, they were there. My brother had driven them over to Atlanta from Anniston. To them, that was a big trip. When I graduated from medical school, they were there. It was their first plane ride. When I became president of Meharry Medical College, I have this great picture of my mother and father sitting in the front seat. And then when I left Meharry to become director of the CDC, my mother was not there. In fact, she died two days later at the University of Alabama Hospital. But my mother and father have been with me all along, because I am a product not just of Morehouse College and Case Western and Rochester. I'm a product of the church. You know, people at Meharry and the CDC used to wonder why it was that I was such a stickler for starting everything on time. My dad would start superintendent on time, even if only the family was there. And we'd be trying to sing, you know, the opening hymns. He believed that time was important and we should respect people's time. But I want to bring you greetings from the Morehouse School of Medicine in Atlanta. I think most of you know that when I left the Office of the Surgeon General in 2002, I went back to Morehouse to develop the National Center for Primary Care. Along the way, I served as interim president for 2 years. And then when that was over, we decided to establish the Satcher Health Leadership Institute at the Morehouse School of Medicine. Well, I just want to say a word about Morehouse, the Morehouse School of Medicine and the Satcher Health Leadership Institute. I don't know if there's anybody here who's getting continuing medical education. Anyway, I'll show you this just in case. If you're getting continuing medical education, it's important that you read this. Okay. As you've heard, the mission of the Satcher Health Leadership Institute was established in 2006. And it was a mission of achieving diversity among leaders in medicine and public health. So we set out to establish the Health Policy Institute at the Morehouse School of Medicine, and generally to create a diverse group of leaders. We've had a lot of support in that venture. Many of you probably know this young lady who's beside me there as we did a walk with children. That lady was once named one of the 5 top mayors globally. That's Shirley Franklin, who is still very active in Atlanta and is one of the directors of the Civil and Human Rights Museum. But the Morehouse School of Medicine has a vision, which I hope that you will identify with. I know that many of you do. And that vision is leading the creation and advancement of health equity. I'm going to mention health equity a few times in this presentation. So this is my introduction to a concept that I feel very strongly about, and that is the concept of health equity. Now, as Surgeon General and Assistant Secretary for Health, I released the Healthy People 2010 plan, which many of you are familiar with. It was the first time that the nation went on record as being committed to the elimination of disparities in health. Some of you remember that. The morning that we released that report, I got up, as I usually do, and went outside to jog or walk. I'm older now, so it's more walking than jogging. But that morning, it was an unusual morning. There was 6 inches of snow already on the ground in Washington. That's unusual for Washington. We had 2,000 people, I don't want to exaggerate this, 2,000 people in the hotels around Washington. I don't know if Vanessa was there, I'm trying to remember. She was always somewhere around telling me what I should be doing and supporting me. But anyway, on that particular day, the government closed because there was 6 inches of snow on the ground. So I called Donna Shalala, who was the Secretary of Health and Human Services, and told her that we have all these people in Washington. They came especially for the release of Healthy People 2010. And she agreed with me that we should go forward, despite the fact that the government was closed. And so on that day, we released Healthy People 2010 with 2 goals. One goal was to really work toward quality of life, and as people get older especially, to make sure that health was maintained. That quality of life was just as important as how long you live. Now, if you're getting older, as I am, you know what that means, right? It's not just enough to get older. You know, you want to maintain your health. You want to feel good. You want to be able to do what you want to do. And in order to do that, you have to really abide by certain rules, which I'll mention later. The second goal of Healthy People 2010, as I mentioned, was the elimination of disparities in health among different racial and ethnic groups. Now, at the Satcher Health Leadership Institute, we have 4 leadership development programs. And I won't go into detail about them today. There are probably some people in the audience who've been through one of the programs, the Community Health Leadership Institute. So we have a fellowship for physicians and other health professionals. We have a community health leadership program, and we've had city councilmen, community leaders. We've had 10 mayors to graduate from that program. And we just got funded to expand the program for mayors. We have a quality parenting program, one of my favorites because, in part, I guess because of my own parents, I believe that parenting is important, that it's probably the most important job that anybody will do. And so we decided that if we could help people to be better parents, they could help us to create a healthier society. So back in 2009, we took our first group, take about 100 parents a year, most from the local community, and they study child nutrition. They study communication between parents and children. They study the development of the brain, and the way it develops rapidly in those first 2 years of life. We have now had about 400 parents to graduate from that quality parenting program. Well, these are the goals, which I won't dwell on any longer, but you see that word quality. The quality of your life depends upon several things. How you eat, whether you're physically active on a regular basis. The quality of your life depends upon several things. And we felt that we should focus as much attention on that as we did on the length of life. And then we thought it was time for this nation to face up to the need to work toward the elimination of racial and ethnic health disparities. So what do we mean? What did we mean by that? And I think it becomes clearer as we move through the years. And Healthy People 2010 was released in 2000, right? It was a plan for the next 10 years. So Healthy People 2020 was released in 2010. And I was not around. I was not in government then. But I want you to look at the relationship between Healthy People 2010 and Healthy People 2020. You see words like quality, right? Free of preventable diseases, and I know you're committed to public health. Achieving health equity, eliminating disparities. I was really so happy that they carried over these very important goals in Healthy People 2020. Create the social and physical environments that promote good health for all and promote quality of life. Those are the goals of Healthy People 2020. So maybe it's time for us to really stop and look at this whole issue of health equity. And hopefully some of you have seen this definition of health equity. What is health equity, and how does it differ from equality? And what we try to say here is that health equity is making sure that everybody has the opportunity to achieve optimal health. Everybody. Now, if you live in a community where you have parks, safe streets, you even have a group, and you get together every morning and you go walking, it's a little bit easier for you to do that than if you live in a community where there's no parks, no safe, and it's not even safe to walk out on the porch. So health equity means that everybody has the opportunity, right, to achieve good health. That's what health equity is about. It's our responsibility as a society to make sure that everybody has the opportunity to be healthy. I mean, if you live in a community and there's no place to buy fresh fruits and vegetables, most people, not all people, but most people will end up not eating as many fresh fruits and vegetables as people who live in a community where the grocery store is right around the corner. So we have that responsibility to make sure that people have the opportunity to be healthy. Now, the concept of health equity Actually, it didn't start with me. I was asked by the World Health Organization to work on a project dealing with social determinants of health after I left government. We worked on that project for 5 years. There were 24 people. They were from all over the world, India, Africa, China, and then we came up with a definition of social determinants of health. But it was after that that the World Health Organization actually set the goal of global health equity. Global. In other words, we've often said, well, people in Africa, they're poor, they're not going to have the kind of health. We decided that it was time to set the goal of global health equity. And when you do that, when you set that goal, you've got to make a lot of changes. First in America, but you got to make a lot of changes all over the world. And so that's what we're now committed to, and I think that's appropriate. So, you certainly understand, even if you're not from the country like I am, you understand the difference there between health equity and equality. All of those persons have the opportunity to reach the fruit on those trees, not because they're equal height, but because we have provided for them to be able to reach that fruit. That's health equity. That's health equity. Well, now, some of you are familiar with the work that we did at Morehouse, and this was published in 2005. We asked the question, I don't think we were the first. I think somebody at the Urban League raised the question, what if we were equal? And so we decided that a good place to apply that would be in health care, in public health and medicine. So we did a study at the turn of the century, and we asked that question, if African Americans had the same health outcomes as the majority population, what would the data look like? How many lives would we save? And this is the study that we published in the Journal of Health Equity in 2005. Can you believe that 83,500 blacks who are dying now or who were dying then would not have died if we had had health equity? And this is really not health equity, it's eliminating disparities in health. You may see some areas on there that you're familiar with, like heart disease, like diabetes. These were the number of deaths among African Americans beyond what we experience in the majority population. It's not the number of deaths, it's the number of deaths, excess deaths we call them. Those are excess deaths. You know somebody with diabetes, you have diabetes, your doctor has been trying to get you to change your diet and walk every day. Well, I hope to give you some encouragement. Being physically active saves lives. Good nutrition saves lives. And we want your life to be saved. So these are the excess there. It got a lot of attention because it's one thing just to talk and talk about disparities in health, but when you can put numbers on them, as we did in 2005, it helps people to take notice. And not only that, and I was really pleased with the way the Obama administration responded to this issue, but health insurance coverage. 2.5 million more African Americans would have insurance coverage if we had the same rate of coverage as the majority population. Now, I want to make sure that this is clear. Now, if you take the Affordable Care Act, which a lot of people like to call Obamacare, most of those people are against it, so I try to stay away from that term. But I think one day Obamacare would not be viewed negatively. People will realize the impact that it's having on health. Because now many more people have insurance than before the Affordable Care Act. Many more people. And so despite the politics, the goal of the Affordable Care Act was to cover more people, was to make sure that people were not excluded from health insurance because they had a pre-existing condition, right? To make sure that mental health was covered along with other areas of health care. Well, I must confess that when we published this, I didn't fully understand what it meant. It was really not until my work with WHO and the social determinants of health that I realized that these data were helping us to appreciate the impact of social determinants of health on health outcomes. So that dotted line is black females and the mortality ratios between black females and white females. And would you believe that in 1960, black females had the highest mortality ratio of any group? Now I'm trying to show you the progress that has been made with that group. It's interesting also, of course, that black females have made progress in the social determinants of health. Some of our colleges, unfortunately in a way, have 5 times as many women enrolled as men. Unfortunately, because I think we ought to have our men and women, our boys and girls, getting the optimal education. And I take my hat off. I think black females have done well, and you can see it in life expectancy. Black females have made more progress in life expectancy over the last 10 to 20 years than any group. And that includes white females. So what happened to black males? Well, in 1960, the mortality ratio for black males to white males was about 1.3. It was better than it was for females. However, if you look at 1980, you see how that line takes off. What happened in 1980? Well, a lot of things like crack cocaine, HIV/AIDS, all of those things became major factors. And so it tells us clearly what we have to do as we struggle with HIV/AIDS today, and especially for black gay men in the South especially, have such a large mortality ratio. And then there's prison. Crack cocaine led to so many of our young men being arrested and imprisoned for years to come. And when black men are in prison, it affects the whole community. It certainly affects black women, and it affects families. It affects the community. So that has to be a part of our equations. So what are social determinants of health? Social determinants of health are the conditions in which people are born, in which they grow, live, work, and age. Conditions. So that's why I love this meeting, because, you may say, well, I'm a physician, and I get this asked of me all over the country. Dr. Satcher, what's my role in dealing with the social determinants of health? I was asked that at Boston University. I can go on and on, but those residents want to know, do we have a role in improving social conditions? The answer is yes. Why do we have a role? Because it's about health and health outcomes. You say that one of your areas of concern is public health. Well, what is public health? Public health is the collective efforts of a society to create the conditions in which people can be healthy. That's public health, to create the conditions. Everybody has to get involved. It has to be those who plan communities. It has to be people who look at wages. Are people getting enough wages to really lead healthy lives in their communities? All of those things are part of the conditions for social conditions. They're shaped by, and this is what upsets a lot of people, but it's true, they are shaped by the distribution of money, power, and resources at a global, national, and local level. You cannot separate health from income. You cannot separate health from education. Cannot separate health from safety. If you live in a community that's not safe, it is unlikely that you're going to practice health behaviors at the same extent as somebody who lives in a safe community. Those are the social conditions. You know what? In order to change social conditions, you really have to make some policy changes. I'm hoping that the people who go through the Satcher Health Leadership Institute benefit for themselves and their families, but I hope also that they become better citizens, that they realize that there's some questions you ought to ask people who are running for office, right? If they're running for office, you ought to ask them certain questions about what they're going to do and what they're going to stand for. If you don't, then we're never going to achieve health equity. Well, I don't have that much time left, so I'm going to go rapidly through this, and you forgive me for this, but I did want to talk about the human brain, and I want to talk about the Surgeon General's report on mental health, which we released in 1998, soon after I became surgeon, one of my first reports after becoming Surgeon General. Well, you see the various, this is the brain. What I want you to understand is that in order for this brain to develop normally, you need good nutrition, you need safety, you need physical activity, and you need communication between parent and child. You need it as early as possible. That communication influences how the brain develops. It's very, looking at that structure, would you think that you would have head-to-head contact and think nothing of it, of the kind that we see every day? Now, I always liked football. Let me confess, I always liked it. But I also believe that we've got to protect the brain. If we cannot, and this is a position that I've taken with the NFL and everybody else, if we cannot find a way to protect the brain, then we're going to have to do something about that game that we call football that so many of us enjoy. I mean, it's no fun to go around banging heads when you know what's in that head. The brain, the most important organ in the body, the brain. The frontal lobe of the brain, responsible for planning, language, judgment, all of those. It's a very important area. The whole brain is important. The parietal lobe of the brain deals with sensory and calculation. The temporal lobe, very important, language, hearing, memory. You talk about a disease like Alzheimer's, and even though we still have a lot to learn about Alzheimer's, it is very clear that when you look at the brain, when you dissect a brain with Alzheimer's, you see what's happened in the hippocampal area and other areas related to the temporal lobe. So the brain is important, and we need to do everything we can to develop it in our children and to protect it. That's the brain. Well, when I served as chairman of the Action for Healthy Kids, I had just, as Surgeon General, before I left office, I released the Surgeon General's report on overweight and obesity. Now, if you have not read that report, and I want to ask you to raise your hand, you ought to discuss it sometimes at your church. You ought to discuss that report on overweight and obesity, because especially as it relates to children, by the way, childhood obesity tripled in this country between 1980 and 2000. Triple. And it says something about what's going to happen to our children in the future if we don't reverse that trend. And thankfully, a lot of states are reversing that trend. But I want you to look at this slide. What it shows is that the brain lights up with physical activity. It lights up. I mean, it's like rejoicing. Here comes physical activity. So after walking 20 minutes, this is what, if you use imaging, now you realize this is imaging, right? Where you inject dye and it shows the circulation. So after 20 minutes of walking, that's how the brain lights up. Now, if you think I'm just talking about children, and we do know that this is true for children, by the way, we were able to show that children who were physically active and ate a healthy breakfast did better in school, did better in math and science, were better disciplined, all of those things. We were able to show that children who were physically active and ate a good breakfast. Now, the interesting thing was, of course, you know that so many schools have already cut out physical education. And then we come along and find out that physical education is a major part of learning. Major part of learning. And if there is any prevention for Alzheimer's, and the jury is really still out, the evidence would say that it is in our physical activity. If anything delays the onset of Alzheimer's, it is physical activity. That's the only thing we have been able to show any kind of connection. So there are a lot of reasons to be physically active and to engage in good nutrition. These are some other reasons: physical activity and mental health. Studies show that physical activity reduces depression. It elevates moods. Studies show that physical activity improves mental acuity. We showed that in the children, right? Studies show physical activity improves sleeping. Yes. You're having trouble sleeping, there are a lot of things, and most people, of course, turn to drugs. But people who are physically active sleep better than people who are not physically active. And studies show that physical activity reduces stress and anxiety. I'm going to run through these slides. Mental health we define as the successful performance of mental function, resulting in productive activities, fulfilling relationships with other people. This is mental health now. And the ability to adapt to change and successfully cope with adversity. That's what mental health is. Now, if you know the definition of mental health, you're very close to defining mental illness, right? You're very close to defining mental illness when you get to the point where there are problems with functioning mentally. Most mental disorders first show up in the home, right? They show up in home. It has to do with relationships. Can you develop and maintain a fulfilling relationship with other people? Very important for mental health. And it's very important because mental disorders can be treated. Mental illness is treatable. And yet we put people in jail and prison rather than make sure that they get treatment. And that has to end, that day has to end. And there were several messages. Mental health is fundamental to overall health and well-being. Mental disorders are real. I know I disagree with some people who say that mental disorders are more spiritual than physical. Mental disorders are just as physical as cardiovascular disorders. It doesn't say that they're not spiritual, because in a sense everything is spiritual, but it doesn't mean that they don't have a basis in the brain. Mental disorders are disabling. Mental disorders are as disabling as cancer or heart disease in terms of premature deaths and lost productivity. And did you know that the average life expectancy of a person with mental illness is set 25 years less than the rest of the population? Now, why is that? Well, it's not altogether clear, but one thing is clear. People with mental disorders are far more likely to smoke, far more likely to be overweight, and that's been noted for a long time. So mental disorders interfere with one's ability to lead a healthy life. Mental disorders are common. 1 in 5 Americans has some kind of, and we believe that it's higher than that, diagnosable mental disorders each year. You ought to really have some discussions at your church about mental health. I mean, I go to church. I mean, I know that every Sunday we read the list of the sick and shut in, but I never hear anybody mention people who are suffering from depression and things like that, because it's not cool, right? Yeah. But mental disorders are just as real as disorders of any other system. And if we're going to make progress, we got to deal with them as just as real. So there's good news. We've improved our ability to recognize, diagnose, and treat conditions effectively. And 80 to 90% of mental disorders are treatable using medications and other therapies. There are other therapies, what some people call talk therapies. Meditation, becoming clearer every day that those are approaches that help with mental disorders. They also help with hypertension, right? If you haven't tried it, try it. Now I'm going to close. Don't worry about the small print. Upstream, midstream, and downstream. What's upstream, what's midstream, what's downstream? Downstream is where we deal with individuals, physicians. I know you have some great physicians in this audience. But dealing with individuals, trying to help them improve their health, is downstream. Midstream is community. It's when the school is giving children what they need. It's where you have safe streets. That's midstream. So what's upstream? Policy. It's where they make policy. Now, usually when I ask that question, people say, well, it's Washington. Well, Washington is only one place where they make policy. Parents ought to make policy in their homes. You know, like, you're not going to get dessert until you eat your vegetables. That's a policy. It's a policy. I have to tell this story. There was this man who decided to fly across the country in a hot air balloon. And so he got in the balloon and he was flying, and all of a sudden he realized he was lost. He had no idea where he was. So he decided he would lower the balloon to see if he could spot some recognizable landmarks, you know, like the Washington Monument or the Golden Gate Bridge or Gateway to the West. He saw nothing that he recognized. So he just kept lowering the balloon. And when he got to about 30 feet above ground, he spotted a man working in the field below. And he yelled out, "Where am I?" And the man stopped digging and looked up and said, "Well, you're in a hot air balloon about 30 feet above ground." So the man in the balloon said, you must be a scientist. You sound like a scientist or something. And the man said, "I am a scientist, but how in the world did you know that way out here?" And the man in the balloon said, "I knew that because what you told me is technically correct, but it is of absolutely no use to me right now. None." Well, not to be outdone, the man on the ground said, "Well, you sound like a policymaker or something." And the man in the balloon said, "My goodness, I'm a leading policymaker, but how did you know that?" And the man on the ground said, "I knew that because you're in the same position you were when we met. You don't know where you are, you don't know where you're going, and now you're blaming me." We give policymakers a tough, and most of the time they deserve it. But now, I wish I had time to talk about the Surgeon General's prescription. Oh, you're going to give me 10 moments? Thank you. Wow. I will talk about the Surgeon General's prescription. Now, as you know, I was director of the CDC before I became Surgeon General. That had never happened before. No director of the CDC had gone on to be Surgeon General. So you can imagine that I had some biases, and one of them was prevention. I believe that prevention was critical and that the Surgeon General ought to lead it. And so I said before I left the CDC that I was going to have a Surgeon General's prescription, and started working on it. And then one day President Clinton asked me if I would represent the United States at a global conference on health promotion and disease prevention. And I decided that this was my chance. They had already told me that there would be 189 ministers of health at the meeting in Hermosillo, Mexico, and that each minister would have only 5 minutes to speak. And what can you say in 5 minutes? So, but I decided that was the opportunity for me to release the Surgeon General's prescription. You can read that in 5 minutes. So this is the Surgeon General's prescription. And I hope, Vanessa, I'd be happy to send enough of these for everybody who wants it. But What is it about? It's about physical activity. It's about fresh fruits and vegetables. It's about avoiding toxins like tobacco and illicit drugs. It's about responsible sexual behavior, which I don't have time to discuss because everybody always gets nervous about responsible sexual behavior. So, but it means, especially when you say that, for some people that means abstinence. What do I mean by that? I have teenagers who ask me, especially if they're in school at Spelman or Morehouse, you know, should I be sexually active? Or people laugh at people who are not sexually active. And I tell them, you don't have to be sexually active because, quote, everybody else is doing it. That's not the reason to be sexually active. And you ought to make sure you're careful about when and how you become sexually active. I don't apologize for that position. Don't apologize. Daily participation in relaxing and stress-reducing activities with adequate sleep. Yes, the Surgeon General prescribes adequate sleep. Sleep is amazing. It's amazing. You may not realize until you can't sleep. You know, when you can't sleep, you realize how amazing sleep is. So I recommend that you do those things that help you to sleep. Well, I am going to end. The Surgeon General, Jerome Adams from Indiana, came by to see me last week, and my first-year students and others had this great idea. We're going to get these two surgeons general together, and we're going to ask them questions. So they called it the fireside chat. And to be honest with you, it was a great experience. The students had great questions. But I think what is very clear is that whether you're in medicine or in the ministry or community leadership, we have some tremendous opportunities staring us in the face to improve our health. Now, I don't brag about my physical activity. It is true that I completed the Marine Corps Marathon in 2001. I was 61 years old. I ran 26.3 miles. The only reason I could do that is that over the years I have remained active, and I recommend it. You know, you ought to remain physically active. And if you do that, your health will show it. It will improve. So it doesn't take as long to get in shape when you've stayed in shape. So I recommend that. I mean, you're an amazing group of people. We need you, and we need you at your best. Could I show that last slide? I'll give you a minute to read it. That's the Satcher Health Leadership Institute's motto. And it says, in order to eliminate disparities in health and achieve health equity, we need leaders who first care enough. I mean, I tell our students, there's a reason why our profession is called health care, because it starts with caring. It starts with caring. If you have a doctor who doesn't care, you're in some big trouble. Since other people have also talked about what doctors should do, I'm going to get my 5 cents in. They need to care about their patients and about themselves. They need to know enough. We require our students to know enough. They need to have the courage to do enough. And we need leaders who will persevere until the job is done. Thank you.